Hi everyone, welcome to the final presentation on the Latin American, the Caribbean Competency virtual series. Today, Dr. Chavez will be talking about the impact that COVID has had on Latinx populations. And thank you so much for presenting today, Dr. Chavez. If anyone has any questions, you can use the chat feature or the raise hand feature at the end, and I'll leave it to you. Thank you.
Thank you, Alex, and thank you to the Center for Latin American Studies for this invitation. I'm very glad to be able to share some ideas, some thoughts with all of you. Today, we're going to be talking about invisible in the time of COVID. My name is Diego Chaves-Gnecco. I'm a developmental behavioral pediatrician. I am an associate professor at the Department of Pediatrics School of Medicine, and I'm also the director and founder of Salud para Niños, Health for the Children at Children's Hospital of Pittsburgh. So today, we're going to be talking about invisible in the time of COVID. And the name of this presentation comes from a famous novel, Love in the Time of Cholera, from our Nobel Prize Garcia Marquez. And that also actually talks about another pandemic, the pandemic of cholera in Cartagena, Colombia. So if you guys haven't read this book, I highly recommend it. And as I said before, today we're going to be talking about invisible in the time of COVID. So there is this video that Alex might share with you guys later. We might be able to share later if we have time, but if not, you can watch it on your own. And basically, even though this video is from the beginning of the pandemic last year, around May of 2020, there are a couple of lessons that I think we still can learn from this video. And one of them is precisely what it says there, and is that at the end of the video, one of the community leaders mentioned that the importance of paying attention to Latino communities, that this is a wartime situation. And we're not going to make anyone safer by having any portion of the population sick, because then everybody's going to be sick. So it's in the best interest of everybody to make sure that every segment of the population is being covered. Right now, the biggest topic is vaccinations. And I probably will paraphrase what this community leader said about a year ago, and is that we're not going to make anyone safer by having any portion of the population without being vaccinated. We need to vaccinate everybody so everybody's safe. When we say that we're in this together, we're truly in this together. So the aims of this presentation is to review some demographic characteristics of the Latino community. We're going to review some epidemiologic characteristics of COVID-19 in Latinos. We're going to learn why Latinos are especially vulnerable to COVID-19. And we're going to learn what can be done to support and help the Latino community. We're going to talk about advocacy and community resources. So the first couple of slides are going to be talking about demographics, both in the US and in Southwestern Pennsylvania and in the state of Pennsylvania. Perhaps the most important point for you guys to remember is that as of now, 18.3% of the population in the US is Latino. Here we have some demographic pyramids that go by age. And the other important point from this slide that I mentioned already is that Latino population tends to be a younger population. So 1/3 of the Latino population in the US is under the age of 18, while only 1/4 of the general population is under the age of 18. So Latinos in general tend to be younger than the rest of the population in the United States. This is based on the an estimated from the Census Bureau from 2018. We're waiting, and it sounds that in the next couple of days, couple of weeks, we're going to be hearing about the census of 2020. So this might change, but most likely, if anything, the number is going to be higher. Again, I want you to remember this percentage, 18.3, because it's something that we're going to compare when we think about the COVID-19 pandemic in the United States. So a few points about Latinos in the US. 70% of us were citizens, 89% of Latino children are born in the US, 52% are second generation, 37% are third generation. 77% speak Spanish, but 62% of Latinos also speak English. 67% of Latinos who are 25 years and older had at least a high school degree, 50% are homeowners. And actually these numbers that I'm gonna share at the last, these are not from the recent election, these are from 2016. At that time, 19.5 million voted and 25 million were eligible to vote. I would promise for the next time that I give this presentation, I will have updated data from the election of 2020. Now, narrowing our numbers, we were reviewing the national numbers. We're gonna narrow to the state numbers. So in Pennsylvania, Latinos are close to 1 million out of 12 million, close to 13 million that are in the state. I like this slide a lot because it put emphasis in a concept that I want you all to learn, understand, and remember, and is that race and ethnicity, they are not interchangeable. And here explains why. You know, you can be white and Latino, you can be black and Latino, You can be African American and Latino, you can be Asian and Latino. And as a matter of fact, here in the state of Pennsylvania, we have actually a population in every single of these categories. And it's important because, again, sometimes people use interchangeable race and ethnicity, and that's not correct. And ideally, you should have two separate categories, one on race, one ethnicity. As a matter of fact, some of the slides that I got from the CDC and that I'm going to share with you actually use on the same slide, race and ethnicity, but clearly they make the differentiation that, for example, when they are talking about blacks, is non-Latino blacks or whites, non-Latino whites. The other important piece that I want you to remember is this number: 7.6% of the population in the state of Pennsylvania are Latinos. Again, this is from 2018 estimates. Probably when we get the numbers of 2020, they're going to be higher. I think this number of 7.6% is really important, and I'm going to tell you why. When we talk about the pandemic of COVID-19, you guys all have seen in the news, in TV, in press releases, how, for example, our county health department director, Dr. Deborah Bogan, or our health department, state health department in Pennsylvania, in the past, Dr. Levine, and the most recent health department directors in charge, they have given these press releases, these presentations, and they usually give it with simultaneous sign language, which is great. And it turned out to be that the percentage of hearing impaired population in the state of Pennsylvania is close to 8%. However, let's remember that we are about a year and a few months into a pandemic. We still don't see that any of these press releases come with closed captions simultaneous in Spanish or interpretation in Spanish. And that's a problem because we're forgetting a large segment of the population. We have a lot of people who just don't know what is going on, and they might be missing opportunities. Today, for example, UPMC is having a great vaccination campaign in Pittsburgh Mills. It's a drive-through, and throughout the day, the plans were changed. It was supposed to be by appointment only, and they decided to release this and to make it walk-ins for vaccination. By the way, if any of you haven't get your vaccine and want to go, you can go to Pittsburgh Mills today, tomorrow, and you can just get your vaccine without an appointment. They're using the Pfizer vaccine. But all those releases, all those information, all that important and vital information that is given to community is given to a community in English. It's not given to a community in Spanish. And actually, it's heartbroken because it makes me think that a lot of people are missing really important information that they should be getting otherwise. And it's not surprising that when we see these numbers, we see that the Latino population is overrepresented in the number of cases, in the number of deaths related to COVID-19, in the number of hospitalizations. So this is from the CDC, and actually this is from today, April 14 of 2021. And if you look, the number of cases during this pandemic that the CDC is reporting in the United States is that 70% are non-Hispanic Latinos, while almost 30% are Hispanic Latinos. And if you remember the number that I gave you before, this is almost double of the percentage of the population in the general population in the United States. So we're 18% of the general population in the country, but yet we correspond to almost 30% of all the cases of COVID-19. So definitely an overrepresentation, definitely a huge disparity in terms of cases of COVID. Now, this is another slide that I mentioned to you guys before, where they use some percentage in terms of race and some ethnicity. Now, the race group that had been affected the most in this pandemic is definitely the non-Latino white, with almost 50% of the cases, but there is definitely a representation in Latinos, as I mentioned before, close to 30%, and in African Americans, close to 11%. And again, this is from today's data from the CDC. The other important piece on this is that the data collected on these cases was in 24 million cases, but only there was data about race and ethnicity in 15 million cases. And this is another huge problem. If we don't know what is the race of the ethnicity of the people who's getting sick, how can we address the problems that are affecting that community? You know, when I started giving these presentations about a year ago, you know, it was understandable that the pandemic caught us all by surprise and we didn't have the techniques, the resources to collect this data in terms of race and ethnicity. But we are here a year and a few months into the pandemic, and we're still having problems with getting accurate information in terms of race and ethnicity of people who are contracting the disease, people who are dying from the disease. And that's a huge problem. We cannot address the problems that if we don't know them. And that's one of the reasons that the name of this presentation is invisible, because we definitely have a large segment of the population who is still being invisible to the eyes of the epidemiologists, to the eyes of public health, to the eyes of those who are recording the numbers of the pandemic. In terms of vaccination, and this is kind of like a new, since the last time that I give this presentation, we see that a lot of progress has been made over the last several months, but still there is a huge disproportion in terms of who is getting vaccinated. The majority of the people who are getting vaccinated are whites. I mentioned before that this is a condition that has been affecting highly in our country, Latinos and African Americans. And if you look, only 11% of the vaccines that are given goes to Latinos, and only 8.5 of the vaccines that are given go to African Americans. So we have a big problem in terms of the people that we're reaching, the communities that we're reaching. We need to do better in terms of vaccinating our diverse communities and our minority communities. Now narrowing again to Pennsylvania, these are the number of cases by ethnicity in our state. And again, you can see that Latinos has an important number, but perhaps the most important part of this slide is that we have a large proportion of cases that are not reporting race or ethnicity. And that's still a problem because that's a way that we are being blind to who is being affected by this condition. Similar to that, these are numbers in terms of mortality. And again, all these numbers that I'm presenting are from today, except for this one. This one is from last Friday. This is a mortality report that the state of Pennsylvania Department of Health releases every Friday. So this is from last Friday. And here is the number of Hispanics who have died from COVID, the numbers of non-Hispanic who have died from COVID. Again, we have some problems in terms of accounting for who is getting the condition and who's dying from the condition. And then we look into terms of vaccination in Pennsylvania, again, similar to that. The majority of the vaccines are going to non-Hispanics. A lot of people, we don't know what is their race or ethnicity, but just a few proportion are going for sure to Latinos. So we have a huge gap, a huge disparity in terms of what we need to accomplish. And let's imagine that this was a representation of the population of the state of Pennsylvania. We should be here at around 7 to 8%. Or if we're talking about in terms of the cases, again, we should be at a higher number. But we're not going to solve this problem unless we solve this particular problem, which is to know exactly who's getting the vaccine in terms of race and ethnicity. Now, this is from the county, from Allegheny County. And it called my attention because I hadn't looked at these numbers until recently, until today. I had looked in the past, but today it called my attention that, if you're Latino and you get tested, you have 20% of chance to be positive. So while Latinos we're not that many in Allegheny County, and I will show you the numbers in a few minutes, it is important that if we're Latinos in Allegheny County and we get tested, the chance that we have a positive test is huge, 20%. If you look at the news today, they were announcing that we're very concerned because in general testing is coming back at 9% positive. Having 20% positive is huge. That's a huge problem in our community. So that is really concerning. Results on percent of cases resulting in death, 3% in Latinos. So again, this is a huge disproportion and it's a problem, and this is just Allegheny County. Now, when they look at the raw numbers and the converting percentage is 1%. So, maybe the numbers are just behaving like the general population. I'm going to show you the numbers of the general population in Allegheny County. Still, we have a lot of numbers who are unknown, and this is a problem. Now, I have to admit, when I talk to, for example, the director of the health department, Dr. Bogan, about this, she tells me that a lot of the numbers that they get from third parties. So, if somebody's tested in a health facility, it's the responsibility of the health facility to collect that information, race and ethnicity. I will tell you, as a provider, as a pediatrician, we do a lot of testing in our clinic. We use electronic medical record. Unfortunately, electronic medical record is not necessarily accounting for race and ethnicity separately. And I have to bring that issue to the people who run the electronic medical record. We haven't been able to change that. There is an option, but it takes a lot of steps where you put other and then you clarify the ethnicity. Still, it puts a lot of work in the provider. I try to do it myself because I think this is really important that we know for sure who is contracting the disease. But this is one of the reasons that it's not happening. This is one of the reasons that we have this large number of unknown race and ethnicity cases. In terms of vaccination, this is from Dr. Bogan. The Allegheny County specifically got about 10% of the doses. The majority of the doses went to hospital pharmacies, federal qualified centers. And then this is the number of people who are getting vaccinated. And again, similar to what we saw at the state level, only 1.4% of the vaccines are getting to Hispanics or Latinos. We need to increase this. This is a population that is vulnerable to this condition. I'm going to explain to you why in a few minutes. We need to address this problem. We need to do something about this. Okay, So why, what is the problem with Latinos and COVID? Latinos are 3 times as likely to contract COVID. So it's 3 times more than any other populations, twice as likely to die from COVID, so higher mortality, higher morbidity, higher risk of contracting COVID in Latino communities. I'll explain to you in a few minutes why. Higher risk of social determinants effects. Again, I will explain to you in a minute why. Higher mortality in Latinos communities. I mentioned this before, 18% of the population nationwide is Latino, but 27% of all COVID-19 deaths belong to the Latino population. And then actually there are some specific examples like New York, Chicago. In New York, 29% of the population is Latino, but 39% of all COVID deaths belong to Latino population. So why is that? One of the reasons is that because we Latinos tend to have higher number of essential jobs where we work in healthcare, and in healthcare it could be at different levels: physicians, nurses, housekeeping, in the service industry, in food services, in restaurants, in construction. The other thing is that because of these jobs are essentials, when people were recommended to stay at home, everybody had a lower possibility to work from home. Therefore, we were higher exposed to COVID-19. The other problem is that there was not the option necessarily to not work, because a lot of these families depended on this job. So it was a matter of, surviving, putting food at the table, and they had to go out and work. 49% of Latinos have health insurance, which means 51% is uninsured. And that's a problem because we know that COVID-19 is a condition that highly affects people who have chronic conditions who are not well controlled. So we know that obesity is high risk for complications. Hypertension that is not well managed is a risk for complications. Diabetes that is not well managed is a risk for complications. So of course, if you don't have health insurance, the chances that you have hypertension is well managed is probably zero. Same thing with obesity, same thing with diabetes. So it's not surprising that we have a problem here. And if we want to address this issue for this pandemic and for future pandemics, because we know that this is not going to be our last pandemic, one of the things that we need to think is about how can we make sure that everybody has health insurance. Health insurance has demonstrated in this pandemic that is not a privilege. It should be a resource that everybody has access, because having people uninsured, it actually put people, the general population, at risk for things like a pandemic, and in this case, the pandemic of COVID-19. Of course, if you don't have health insurance, you have less access to healthcare, less access to preventive care, higher risk of social contact because you have to go to work. We mentioned the problem with diabetes and obesity, which by the way, they are per se, the population is a higher risk for these conditions. And again, higher risk for cardiovascular conditions, hypertension, with poor control and due to lack of health insurance. So those are the reasons that the Latino population tend to be more vulnerable to COVID-19 and to complications of COVID-19. The other problem that we have is unemployment. The rates of unemployment grew through the pandemic, and in some point was as high as 14.7% in the general population. Right now, the latest number that I checked, we're in about 6%. But this unemployment affected many segments of the population, and some segments were affected harder. Like, for example, Latinos, the unemployment went as high as 19%. And of course, if you don't have jobs, you are not able to supply for your basic needs, food, insecurity, etc. Again, I mentioned before that there's a higher number of jobs in service, industry, hospitality, office, farming. And again, this put us risk on the population. During the pandemic, there were some mentions about rural communities. This one was an example. And in general, as I mentioned before, because the information is still not being provided a year and a few months into the pandemic in Spanish, there is a lot of people that don't know what is going on. There is a lot of people that don't have the right information about how to protect themselves, how to get vaccinated. And that's something that we need to change, hopefully, in the future. Here I'm quoting our Texas representative, Veronica Escobar, who actually herself was quoting Dr. Fauci. And Dr. Fauci was saying that Latinos had a vulnerability that it was comparable to those people in nursing homes and assisted living facilities. And the way to address the pandemic at the beginning, before we have vaccines, was through testing and tracing. Unfortunately, this didn't happen as it should happen in minority communities, in particular in Latino communities. I will tell you, for example, in Allegheny County, I was talking to the director of the health department, Dr. Deborah Bogan, and I was asking how many of her staff were bilingual. And it turned out to be that they rely a lot on interpreters, which is okay. But ideally, what we would like to see is that there are more public healthcare workers who are bilingual, who speak Spanish, and who work for the health department. The second point that I want to make about this is that Dr. Fauci made this statement when the pandemic was starting in the spring of last year. And at that time, the only option that we have to address the pandemic was testing and tracing. And of course, mitigating measures. Now we have vaccination. And of course, the first group of people who get vaccinated, other than healthcare workers, were nursing homes. And I always question, I always wonder why we didn't vaccinate first minority communities if they were the ones who were most affected with this condition. We should be, at least if we didn't do it before, now thinking about how can we vaccinate the most African Americans and Latinos, because these are the communities who are being affected the most with this pandemic. And as I mentioned before, unfortunately, the numbers on vaccines don't show that. We need to increase availability of information in our communities. I mentioned the importance of having information in Spanish, and then we need to do advocacy for our communities. We need to be the voice for those who cannot speak for themselves. The way to address the needs for the general community on this pandemic was to the stimulus package and the federal pandemic stimulus checks. 15.4 million of people in mixed status families were excluded from these payments. 9.9 million unauthorized immigrants didn't receive any of these payments. 3.7 million of children who are U.S. citizens or green card holders didn't receive these payments because they were in mixed homes. 1.7 million of spouses who are U.S. citizens or green card holders didn't receive this. And 5.5 million of U.S. citizens and green card holders were excluded from this relief because of their mixed status. So while people were getting some financial support from the federal government to be able to stay at home, to mitigate the problems and the social and economical problems from the pandemic, the Latino community didn't receive this support. And as a matter of fact, I will expand this. It was not only the Latino community, but it was in general immigrants from different groups who didn't receive this because of the conditions that I mentioned before. There are definitely some racial disparities, and this is from Boston, from Brigham and Women's Hospital, that explain why we have this pandemic: exposure to risk at work, exposure to risk in public transit, exposure to risk in shared living spaces. You know, at the beginning of the pandemic, we were telling families, well, if somebody in the family is symptomatic of has COVID-19, that person needs to isolate it in one room. Well, guess what? For many families, in particular Latino families or families who live in minority communities or African Americans or people who have limited financial resources, they just have one room for everybody in the family. They had a room for 5 members in the family. So what we needed to was to modify the message. And I said, well, if somebody is symptomatic or positive, let's try to isolate that person to a certain area of that room that you all share. And we did talk about the presentation of comorbid health conditions like obesity, hypertension, etc. The problem with access to healthcare and testing. And then this is from Brigham and from Boston. There is clearly racism in healthcare delivery, and we need to try to avoid this. And then there is the fact of chronic stress. Many of our families have been through different chronic stress, different trauma, because of the fact that they had to immigrate, or they had to immigrate for political reasons, or for example, in the case of Puerto Rican families, they have to come to the continent because of hurricanes. So families were already under stress before they were affected by the pandemic, and the pandemic was just another add on to the problems that they were living. So Brigham has some solutions that they're proposing how to address the problems of the community in the pandemic. One is to get transparent data. I have mentioned this before, the importance of get accurate data in terms of age, sex, race, ethnicity, primary language, socioeconomic status. If we cannot get socioeconomic status, at least get a zip code, can be a proxy. We need to screen for social determinants of health. I will tell you, in our clinics throughout this pandemic, one of the things that we have been asking is whether people have food insecurity, and if they have food insecurity, we have some small package of groceries that we can provide to families. We need to employ communications tools when there is limited English proficiency. Ideally, we want to have providers, public health workers who speak the language of the families, but if not, we want to use interpreters. We want to develop communication tools for patients with disabilities. You have seen Dr. Bogan in her news releases where she used a clear mask, and that's ideal for masks with clear windows for people who have disabilities, people who, for example, with lips, but also for people who have English as a second language. Have photos of the clinical team in the waiting rooms can alleviate for anxiety, involve developed personnel in developing clinical and ethical guidelines, and of course, involve members of the minority communities, Latinos, African Americans, etc. So we have been talking through this pandemic, the important things. I just want to remind everybody the importance of avoiding, not necessarily social contact. We're doing some social contact with this type of presentations, but basically physical contact. We want to recommend to maintain physical distancing 6 feet apart, 2 meters apart. New guidelines from the CC talk about maybe only 1 meter or 3 feet, in particular in the setting of schools. We want to avoid social and physical interactions. In the Latino community before the pandemic, it was very common that we use handshaking, hugs, kisses. Of course, this is not a good idea during the pandemic. We want to recommend to avoid social and physical events. And we have been doing this for over a year, and we're still seeing crowded events, religious events, and obviously we need to avoid this if we want to get this pandemic under control. So what I used to tell members of the community is that don't think that the quinceañeras, the graduations, the anniversaries are being canceled. We just need to figure out another way to celebrate, to virtual events, or maybe celebrate it when we have the pandemic under control, hopefully in a few months from now, when we have everybody vaccinated. And again, we want to recommend to avoid physical contact with family members who don't live in the same household. Sometimes people think, and we all think that, oh, it's because it's just my relative, we are going to be okay. But, we don't know. The only way that we can be 100% sure that we're going to be safe is with the people that live on the same roof. We want to recommend to avoid travel, and this is still being an issue. Recommend to avoid religious congregations. I mentioned this before. If there is isolation at home, take into consideration the rooms, whether it's a single room, single bathrooms. We used to tell people use one room for the person who's positive or who has symptoms, use one bathroom, but sometimes that's not an option. So we need to either isolate in the same room or frequent cleaning of the only bathroom that the family use, isolate bed, isolate bathroom clothes, bed clothes, isolate plates and utensils. These are some information about Latinos in our area. So this is Latinos in Western Pennsylvania. We have, and in particular in the city of Pittsburgh and Allegheny County, we have some special conditions, special characteristics compared to our Latinos around the country. One is that it's our countries of origins. Up until the census of 2000, the majority of Latinos in Southwestern Pennsylvania were South and Central Americans, Colombians like myself, Venezuelans like Alex, Argentinians. What we have seen is that has changed. By the census of 2010, the majority were Mexican Americans, and we're looking forward by the census of 2020 is going to show us. Probably there's going to be a big increase in Puerto Ricans, and probably there's going to be also a big increase in other segments of the population. We have to see what it shows us. It is interesting because this is different than what the rest of the state shows. And the rest of the state of Pennsylvania, Harrisburg, and Philadelphia, the majority for sure are Puerto Ricans. In our region, there is a disproportion between education and income. The Latino population of Southwestern Pennsylvania tend to have higher levels of education. However, the income of the Latino population tends to be similar of the income of other Latinos around the country, which is below the median. And then the other important thing that is for us is that here in our region, we don't have a barrio or a neighborhood where everybody lives. Here is the city of Pittsburgh, and here you have the zip codes. In blue are the zip codes where we provide care. So we have Children's Hospital in Lawrenceville, our clinic in Oakland, and the 2 free clinics that we run, one in Beachview, one in the South Side. Those are in blue. And in brown, we have all the zip codes where from the families come from. So while Beachview and Brookline are neighborhoods where and the community is growing, the truth is that we see that the community, the Latino community in Southwestern Pennsylvania lives everywhere, lives in the North Hills, in the South Hills, in Monroeville, etc. Here are the numbers that I promised you about how the Latino population is in Southwestern Pennsylvania. While the percentages are not that high, maybe 1 to 2%, the numbers are increasing. We have seen a significant increase over the last several years. And the latest numbers that we have is that we're close to 45,000 Latinos in Southwestern Pennsylvania, and 1/3 of them are under the age of 18, so about 15,000 Latinos in Southwestern Pennsylvania under the age of 18. And again, we're looking forward to the census of 2020, which probably is going to show us that this number has continued to increase. So important is that we share information with the Latino community. The Centers for Disease Control, the CDC, has information, a phone line that actually also provides information in Spanish. We have our Allegheny County Health Department with a 1-800 line. The 211 line is an excellent line, has 1-800 numbers for each county and actually have interpreters for this line. And in our clinic, we have an option in Spanish that we provide information for our families. And actually, we have been testing now for several months our patients, our kids in our free clinics and in our clinics for kids with insurance. Other resources at the national level, we have Unidos USA, we have Feeding America, where people can find food banks by zip code. Here in Pennsylvania, we have different food banks. There is also a directory for local health departments. During these pandemics, one problem that we have, and it has increased, is the problem with domestic violence and child abuse. And it has to do that people spending a lot of time indoors and sharing the same space. So we want to make sure that everybody's aware that there are resources in case anybody is suffering from domestic violence or child abuse. And there's a way to contact by 1-800 number or by a text. And nobody should be ashamed of this. And if somebody feels that they are victims of domestic violence, they please reach out for help. There are many resources that can be provided. There are ways to help families who are going through these events. I mentioned the importance of addressing food insecurity. During the pandemic, the Pittsburgh Public School had a system of grab and go meals. Some of kids are still doing virtual, so they still have that option. And again, we have the Greater Community Food Bank in Pittsburgh with different pantries, with different locations. WIC is a program that is from the federal level. It stands for Women, Infant, and Children. And they also have different resources for families and food support. And then locally, we have different organizations such as Casa San Jose, and the Allegheny County Intermediate Unit Family and Immigrant Connections, and the Latino Community Center that have been providing a help for our community. Here are some examples. This is Casa San Jose in Beachview. We don't like to do our clinics at the same time when there is distribution of resources. It just happened to be that day we were having the clinic until noon, and then at noon it was starting the food distribution and financial support. But here you have the front of Casa San Jose where families were making line, keeping social distancing. We have our mobile unit in the back. People were receiving, having a food distribution, and they were also getting some financial resources that were provided in conjunction with Casa San Jose to help and support the families through the pandemic. We are aware about the problems in terms of lack of information. So back on May, we did a webinar, a Facebook presentation providing information for the Latino community in Spanish, and it was well received. Joining me on this presentation was Dr. Arbula, who is an infectious disease doctor from Mercy Hospital. And again, this presentation was well received, and we'll make sure that everybody learned in Spanish what they needed to hear about COVID-19. Now, I mentioned that the newest thing is the vaccines. And as of yesterday, everybody in the state of Pennsylvania, 16 and older, can get vaccinated. And we have been lucky to contact and to have organizations like Casa San Jose who are helping families to make appointments and register for vaccines. But if you ask me, the best way to address this is to not have vaccinator brokers or vaccinators intermediaries. The idea is that families can just walk in and go to the clinics or actually get these vaccines wherever they are. So if you ask me, my dream will be that we're vaccinating, for example, in Latino restaurants, both the workers in the restaurant and the customers in the restaurants, that we're vaccinating in grocery stores, Giant Eagle, Walmart, and at the same time in our Latinos store, Las Palmas, La Poblanita, Los Campos, that we vaccinate in our clinics, in our free clinic at Birmingham Clinic, in our primary care center in Oakland. Once we start doing that type of vaccination, we're going to be to truly increase the numbers. We have made a terrific achievement in the number of people who have been vaccinated over the last several months, but we need to do more. The only way that we're going to get this pandemic under control if we have 70 to 80% of the total population vaccinated. Right now in the United States, we have 30% of the population. So we are not halfway through, not even halfway through to that 70 or 80%. And not even think about the rest of the world, which is really behind in vaccinating. So hopefully over the next couple of months, we increase the pace of vaccinating everybody in the community. In order to make sure that people understand the importance of getting vaccinated, we have done also other webinars. This one was done recently, last March 25th, in conjunction with the Pennsylvania Governor's Advisory Commission of Latino Affairs. Again, it was well received. We had a lot of good questions. The idea is that we want to encourage people to get vaccinated and that they are able to make informed decisions, getting all the information that is available to them. I cannot emphasize enough the importance of knowing that the vaccines that we're using are safe and they are efficacious in preventing complications from COVID-19. Even the Johnson & Johnson vaccine that now is being paused because of 7 cases of clotting, I still think that it's a very safe vaccine and it's an efficacious vaccine. And my hope is that in the future we'll resume administering Johnson & Johnson and we increase the number of people who are getting vaccinated in the entire community. I mentioned the problem with food resources. So this is another thing that we did. We donated some money to local restaurants. Here is the Colombian Spot. We gave some money to the Colombian Spot so they were able to provide free meals to different communities. And this was what we call a double track. And the idea was that we were supporting the local restaurants who were not getting their businesses because of the pandemic, but at the same time, we were supporting the communities and being able to provide to them. And this was an initiative of Dr. Mark from UPMC and other doctors who joined in making sure that we were able to provide for these restaurants and these families. Other community resources locally in Southwestern Pennsylvania. I mentioned the concerns that we have for domestic violence, so the Women's Center Shelter of Pittsburgh, Pittsburgh Action Against Rape. All of these resource centers have interpreters, have providers who speak Spanish, and then we also have Resolve Crisis. So it's their concern for domestic violence, for child abuse, for sexual abuse, as well as the concern for mental health. Obviously, during this pandemic, we have seen an increase on problems like anxiety, depression. So we need to have all these resources available for everybody in the community, and in particular for the Latino community. One last word about vaccinations. We have a local unit trial. The Pittsburgh vaccine trial is run by one of my colleagues. Right now, they're recruiting kids for future studies with vaccines with kids. We want to make sure that everybody is able to get the vaccine. Right now, the only vaccines that are authorized are for kids, for adults 16 and older, and that's Pfizer, 18 and older, Moderna, and Johnson & Johnson that is being paused. Pfizer just submit a request for approval for vaccines for 12 to 16. So hopefully with more studies, we can vaccinate all our kids in the near future. And with that, I'm gonna stop. This is some pictures of my team, Salud para Niños, and I'll be happy to take any questions.
I have a question. So a couple weeks ago, I read an article and it was talking about how how in the past minority populations have been misinformed or they haven't gotten enough information to consent to treatments or vaccines, for example, and how that might play a role in maybe Latinx communities or African American communities not wanting to get the vaccine. Do you think we've gotten better at informing them besides of the language gap?
That is a great question, and I really appreciate it. We're aware about that. And in the past, there were a lot of mistakes made, both with the Latino community and with the African American community. I don't know if you guys are familiar with the Tuskegee study, where some African Americans were contracting syphilis and were not provided with accurate treatment. So there have been some unethical things that happened in the past that, of course, generates mistrust among the community. So certainly, this is a concern. And locally, there is a group that is led by one of my colleagues, Dr. Raghavan, who meet on a weekly basis with different leaders of the community and try to address these concerns of mistrust and misconceptions about the community. And the idea is that, as I mentioned before, that people, when they decide to get vaccinated, they make an informed decision. So that's one of the part of the question. But the other thing is that I don't want this concept that there is mistrust or there might be mistrust in some people in the community to go in the way to think that that's the main reason why people might not be getting vaccinated. I think one of the reasons that people are not getting vaccinated is because we're not getting to them. I mentioned in this presentation how important are the social determinants of health. So think about this. You are the head of a family, you're the father and in charge of providing your family. And then you have been unemployed for the last several months because restaurants were closed. And suddenly your restaurant calls you back and says, guess what? We need you to work back in the restaurant. You're happy, you get your job back, you start working. You're not gonna have time to go and call and make an appointment for a vaccine and go into a computer and get the internet and get the phone call and then make appointment an appointment to actually go and get the vaccine. And if you happen to be the 2 doses vaccines, Moderna or Pfizer, then it's gonna be 2 appointments. That's not a priority. The priority for those families is to put food at the table. And that's what I think that in order for us to vaccinate everybody, we need to go where people are. We need to start vaccinating in restaurants. We need to start vaccinating in construction sites. We need to start vaccinating where people are working. Cannot ask people to miss work. They miss work for several months over the last year. And asking them to miss work just to get vaccinated I don't think is gonna happen. So I think it's really important that, yes, we're aware that there have been things that happened in the past that were not right, like the Tuskegee study, that we understand that there might be some mistrust in the general population about vaccines, but that we at the same time provide with the right information. Like, for example, with Johnson & Johnson, I am very reassured by the system. The system is proven that it works very well. We know that they are tracking possible side effects. It's only 6 or 7 cases of clotting in millions of people who have received this vaccine. So it doesn't seem to be a significant number, but still, they are concerned of that they're going to be tracking any clotting cases, and that's really important. And that proves very well that the system is working. So I am behind these vaccines. I think these vaccines are safe. I think that these vaccines are show efficacy. And the important thing is that we trust in science and that we make an informed decision. So we need to provide information for people so they can rely on the system, they can rely on these vaccines. But at the same time, we need to reach families and we need to reach our population where they are. And while I really appreciate Casa San Jose and other organizations like the Latino Community Center who have served for these families to make the connection between the appointments and them, I truly think that brokers, vaccination brokers and intermediaries are just another barrier to get vaccinated. The best way that we can do to increase vaccination is to have no intermediaries between the patient and the person who gives the vaccine. And ideally, we should see what we saw today in the Pittsburgh Mills in Tarentum, where there was a walk-in clinic and where anybody 16 and older could drive there today and tomorrow, Thursday, April 15, before 5 o'clock and just get the vaccine. No appointment needed. It's just between you and the person who is administering the vaccine, which in this case is UPMC. So this is what we need to see, and we need to see more to be done more of this in the community. So yeah, I appreciate your question because we need to acknowledge that there has been this mistrust, and there is a good reason to have this mistrust. We need to acknowledge that. But on the other hand, that cannot be the only reason to think that people are not getting vaccinated. And there are many other reasons. Among them is that we're not getting the vaccine to the ones who need it the most.
Thank you. Does anyone have any other questions?
I have another question. Would you say that the Latinx population in Southwestern PA is doing better than other Latinx populations, or how does it compare to the rest of the US?
So it's really hard. And the saddest part, thank you, Sophia, for that question. The saddest part is that probably we don't know the right answer. And the reason that we don't know is because, as I show you in the numbers, the majority of the numbers that we have is unknown race and unknown ethnicity, both in terms of vaccination, both in terms of cases, both in terms of death. So we don't know. I'm seeing on a daily basis a lot of families who are getting vaccinated. I have here a very heartbroken case of people who had been in the ICU for months. I have here about people who have lost beloveds. I don't know, to be honest with you, how is our population doing compared to the rest of the population in terms of cases, morbidity, mortality, vaccination. My guess is that we are doing probably worse in many ways, among other things because we're being invisible. While New York, Chicago has huge numbers of morbidity and mortality and huge numbers of morbidity and mortality in Latinos, at least they are doing things for the community. They have the message in Spanish. They have local TV in Spanish. They have newspapers in Spanish, daily newspaper. They have those press releases in Spanish. They are reaching out to the community. I don't think we're doing enough. And that effort to reach out to the community is being left on the shoulders of people like me, community leaders, clinics, organizations like Casa San Jose, like the Latino Community Center. I will hope that more is taken by others who have more resources and who have more efforts, like the health departments, both at the state level, at the county level, and by main organizations, the hospitals, etc. So we have done some, but there's a lot of things that we don't know, and that's precisely the point of the presentation. It's invisible. So in that regard, I think we're doing worse because, like for example, the example that I was giving today, I'm so happy that today there was a walk-in clinic for COVID-19. I think it's one of the first walk-in clinics that we have in our area, where people didn't need an appointment. They could just go, and they didn't need to have any specific pre-existence or any specific age, only 16 and older. That's great. But all that information that was released today was in English. I haven't seen anywhere in Spanish saying, hey, if you speak Spanish, read this. There is vaccine, free. You just need to go to this place. You don't need an appointment. You don't need an intermediary. You don't need to go into a website. Just go there, drive there, done. Which, by the way, driving is another barrier. Transportation is another barrier. How many of our families have cars that they can drive to Tarentum? That would be another issue. But yeah, it is a problem, and I really appreciate your question. And I think the one thing that I would like to see is, there are many things on my wish list. One is that we have vaccines in the community, but another thing is that we do better in terms of tracking race and ethnicity, in terms of morbidity, mortality, and vaccination. So a lot of things that we can do better. And hopefully we're learning from this pandemic and we do better over the last several months, over the next pandemics. And the sad thing is that we're being over a year and a few months into this pandemic. And I don't think that thing has changed that much more. So from where I started giving these presentations about a year ago. So unfortunately, we're still being invisible to the general population. Great question. Thank you.
Thank you.
I have another quick question.
Sure.
So I think we're definitely seeing an increase in Latinx representation in healthcare, like doctors, nurses, in a lot of places. So do you think that that's helping spread the word out more to Latinx communities, or maybe it's having an opposite effect? Like, since they are right there with the information so close to them, they forget about some other people that might not have it, as like cannot get informed as easily.
I really appreciate that question as well. I think probably the answer to that is a mix of both. So sometimes when we have people who are helping, like I mentioned so many times, Casa San Jose, the Latino Community Center, the IU, community leaders, clinics like myself, I think sometimes people forget about what they should be doing. And I'm talking about, again, the state health department, the county health department, biggest organizations that probably could do more for the community. That's one problem. But the other thing is that we all have the responsibility to be advocates. And I want to encourage every single of you, and this is something that you guys can do, is to be advocates. So, if you yourselves are Latinos, or even if you're not Latinos, but you care about the Latino community, always ask about, what are we doing for Latinos? What is happening with Latinos? Sophia's question, I really appreciate it. Alex, your questions, I really appreciate it. If we don't raise our hand, if we don't make ourselves visible, we're going to continue being invisible and the points are going to be missed. I've been in Pittsburgh for 23 years, and I think things have changed. We certainly were much more invisible 23 years ago. I started Salud para Niños 20 years ago. There were no pediatric clinics. We were the first pediatric bilingual bicultural clinic. Since then, there are more clinics. That's great. But I still think that we're invisible and there is much more work to do. I have a high regards for my colleague and friend, Dr. Deborah Bogan, who used to work with me in the primary care center in Oakland at UPMC. She's also a pediatrician. She's now the director of the health department. She has been the director of the health department for a year, a job that I cannot imagine how hard it is. And as much as I have high regards for her, on a recent conversation, I was asking her, out of the 400 employees that you have at the Allegheny County Health Department, how many of them are Latinos? How many of them speak Spanish? And they couldn't tell me. And I cannot believe that in the middle of a pandemic, we don't know how many of your staff, tracers, vaccinators, epidemiologists speak the language or understand the culture. Yes, you can use interpreters, and that was one of the answers that I was giving, that they were using interpreters, and that's great, and I'm glad they are using interpreters, because for many years in our region, people were not using interpreters. So I'm glad that people are thinking about using interpreters. But the best way to address these problems is to have people at the table. So we and the people who are at the table can speak for those who cannot speak. I am a pediatrician, and as a pediatrician, we get close to heart that role of advocates, because we need to be the voice for those who cannot speak. In our case, it's kids. Kids usually don't have a voice, they don't have a vote. So we need to talk for kids. But in this case, we also need to talk for Latinos, because a lot of times Latinos don't have a voice at the table. They cannot speak for themselves. We need to make sure that people are aware that there is a large community here. Again, percentage-wise, we might not be what they are in Los Angeles, in New York, in Chicago, but it's a significant number. 45,000 Latinos, if not more, we're waiting for the census of 2020 in Southwestern Pennsylvania. That's a lot of people, 45,000. And in the video that I have the link and that Alex shared with everyone in the chat, if you listen to that video, is what the quote that I was making at the very beginning. In the case of a pandemic, we cannot leave anybody behind. If we leave somebody behind, nobody's going to be safe.
Thank you so much. I completely agree with that. I think, oh God, I forgot what I was going to say. Never mind, I'll remember later. Does anyone else have any other questions or any final remarks? We have time for one more question, I think.
We could also watch, if you guys want, to the video there. That's something that people will be interested in doing.
Yeah, I think we can watch the video.
Okay, it's just a few minutes, and I think we'll have enough time to do it.
Like the African American community, the nation's Latinos are being disproportionately impacted by the coronavirus. The CDC says Latinos represent more than 27% of COVID deaths in hotspots, even though they are just 18% of the population. CBS's Adriana Diaz reports tonight on a group in harm's way.
Since coronavirus can reach every community, so must the message to stop it. And that means in Spanish. Chicago's Jose Gonzalez is a first-generation Mexican-American. He used to work 2 jobs, but lost one in the shutdown. Now his lifeline is cooking at a hotel that's housing COVID patients.
We don't have the benefit of I should just stay home to, not carry on such a high risk. And I feel like that's every Latino at this point.
He doesn't have the luxury of working from home, just like 84% of Latinos, the most of any group. Roughly half of Latino households have experienced job losses or cuts in the pandemic and have $500 or less in savings. Organizer Leone Jose Biquieri of Working Family Solidarity says Latinos are more likely to be in low-wage and now high-risk essential jobs, like in the food industry.
Many of them are balancing. On the one hand, I don't want the crisis of getting sick. On the other hand, I don't want the crisis of being homeless because I can't pay rent and I can't buy food.
Just look at this food pantry line in Chicago's Mexican neighborhood of Pilsen. The undocumented immigrants here don't qualify for unemployment or the federal stimulus, like Rosa, who has 2 kids. Can you sleep? ¿Puede dormir?
No puedo dormir.
You're not able to sleep. You have insomnia because you don't know how you're going to get through this. What do you say to the argument that folks who are here illegally shouldn't have access to these public benefits?
This is a wartime situation. You're not going to make anyone safer by having any portion of the population sick because you're going to be sick.
Adriana Diaz, CBS News, Chicago.
And I will add to that, and that was my message. Sorry. That was my message at the beginning, is that now we're talking about vaccines, and same thing applies to that. We're not going to make anybody safe if we leave a big segment of the population unvaccinated. So my message to all of you guys is thank you for listening. Please remember the pandemic is not over. Make sure you continue applying the biosecurity measures, wearing masks, keeping social distancing, avoiding attending to large gatherings. Protect yourselves. And now that in Pennsylvania we can vaccinate everybody who's 16 and older, please make sure you get vaccinated. And then if you either care for the Latino community or you're yourself a Latino and you think this is important, make sure you're a voice for the Latino community. Ask the questions that were asked today here. What can we do better to help those who are less favored, who are minorities, both Latinos, African Americans? Let's be advocates. Let's be the voice for those who don't have a voice at the table. So thank you so much for having me. I commend you for spending the time during the last hour listening to this, and hopefully we get out of this together. I'm hopeful, I'm optimistic. There's a light at the end of the tunnel. We're in many ways much better than what we were about a year ago. We now have vaccines. We have learned about this virus, but there is still a lot of work to do, and we need to do it together. So thank you so much for having me.
Thank you.
Thank you so much. Also,
Thank
before
you.
everyone leaves it, Panoramas is having a roundtable this Friday. It's going to be about how the Colombian exchange impacted flora, fauna, and food in Latin America. So if you haven't signed up already, please check it out. It's going to be super interesting. And I'll stop recording that right now. Thank you so much.
Thank you. Please stay safe and healthy. Thank you.